This is a thoracic rotation assessment. To perform this assessment, you're going to need something like a foam roller. So we're going to lie down on our side, and the foam roller goes in front of the hips, and we want to rest the top knee or the top shin on the foam roller like so. We could use a couple of yoga blocks here, but what we want to do is we want to be able to stack the hips. Now, if you didn't have the yoga block, chances are this hip would lean forward. So or the roller here. So we're putting this here, hips flexed, knees staying on top. Arms go out to the side in this position, so you're lying on your side. And what we're going to do with this top arm is we're going to reach the hand forward. So we're allowing the top shoulder to move forward in this position. Now this is just one way to enter this assessment. If you can't do this way, I'm going to show you another way in a minute. So from here, reaching the hand forward, and then we want to draw an arc. So we're going to take this hand up and over the head, lightly touching the floor here. When we get to this position, we're going to start to allow the shoulder to roll back, and we're going to roll into the back of the hand, and we're going to continue to rotate all the way down until the arms are in a T shape. So we've brought this arm across this side. Now, what we're trying to do here is we're trying to get both shoulders on the floor, and at the same time, which I just corrected, we don't want that knee to lift. We want to be keeping that knee down on top of the foam roller and getting both shoulders on the floor in this position. So then we can come back, we're touching, bringing the hand back into that position there. So how close can you get both shoulders to the floor from that top down view while you're keeping the knee on the foam roller? Now, for some people, taking the arm overhead like this can be a bit of a vulnerable position for the shoulder. And what we can do if that's the case, if you feel pain or discomfort when you're doing that, is reach the hand forward and then just bring the arm up and over in this position. We can reshuffle the shoulders, and then again, just seeing if you can bring the arms down in this T shape. Can you keep the knee on the foam roller and get both shoulders to touch the floor in this position? Holding that position for 15 to 20 seconds, and then you'll obviously switch sides and repeat. So just so you can see from this view, knee is up, hand goes over the top here, drawing this arc. We allow the shoulders to sink back, we roll into the back of the hand, we can shuffle the shoulders a bit, keeping the knee down. Can we get both shoulders to rest on the floor, holding the arms in that T position, keeping the knee on whatever object we've got there. You can breathe into this, sink into this, see how you go. And then when you're done, just coming back out of it again. When you're videoing this, it's best to video it from a top view, so the camera placed above your head, looking down the length of the body, because what we want to see is we want to see the thoracic rotation. Can you get both shoulders down on the floor? And if not, how far away is that top shoulder from the floor? Then we can start to train this thoracic rotation, improve this mobility / flexibility, just start to loosen up your spine. So this is the thoracic rotation assessment.